My doctor prescribed Opsumit for my pulmonary arterial hypertension. What is Opsumit, and what does it do?
Opsumit is a prescription medicine used to treat pulmonary arterial hypertension, PAH, WHO Group 1. PAH is high blood pressure in the arteries of your lungs. Opsumit can improve your ability to exercise as measured by the 6-minute walk distance. It can improve some of your symptoms. It can help slow down the progression of your disease. Opsumit can also lower your chance of being hospitalized for PAH. It is not known if Opsumit is safe and effective in children. You should know the most important information about Opsumit. Do not take Opsumit if you are pregnant or trying to get pregnant. Opsumit can cause serious birth defects if taken while pregnant. While taking Opsumit, and for 1 month after stopping Opsumit, women who are able to get pregnant must use 2 acceptable forms of birth control. Talk to your doctor or gynecologist about which birth control to use while on Opsumit. When you have PAH, your body may produce too much of a substance called endothelin. This can cause the blood vessels in your lungs to narrow, restricting blood flow and putting strain on the heart. Opsumit targets the endothelin pathway specifically and works to open these narrow blood vessels between the heart and lungs.
How can Opsumit help my PAH?
Opsumit can improve your ability to exercise as measured by the 6-minute walk distance, or 6MWD. In a clinical study of mainly World Health Organization functional class 2 and 3 patients, those taking Opsumit walked, on average, 22 meters farther at month 6 than patients not taking it. Improvement in 6MWD was seen within 3 months. It may take some time to feel the benefits of treatment, but some patients taking Opsumit saw an improvement of at least 1 functional class. Improved functional class can mean the ability to do more physical activity with fewer symptoms such as chest pain, fatigue, or shortness of breath. At month 6 in the clinical trial, 22% of patients taking Opsumit improved their functional class, compared with 13% of patients not taking it. Functional class is a common way for doctors to assess the seriousness of your PAH, which can help them with making treatment decisions. The higher the functional class, the more severe the disease. Improved functional class means you can do more physical activity with fewer limitations. Opsumit can help slow down the progression of your disease. In the clinical trial, disease progression included the need for injectable PAH medication or other worsening of PAH, decreased 6MWD, PAH symptoms getting worse, and the need for new PAH treatment. Patients taking Opsumit were 45% less likely to have their PAH progress than patients not taking it. Overall, 31.4% of patients who took Opsumit and 46.4% of patients who did not take Opsumit had their PAH progress. On average, patients took Opsumit for 2 years. Opsumit can lower your chance of being hospitalized for PAH. In the clinical trial, patients taking Opsumit were 50% less likely to be hospitalized for PAH. 20.7% of patients who took Opsumit and 33.6% of patients who did not take Opsumit were hospitalized for PAH. On average, patients took Opsumit for 2 years. Opsumit can cause serious side effects, including serious birth defects, liver problems, fluid retention, low red blood cell count, and decreased sperm counts. Now that Opsumit is part of your treatment plan, always stay in touch with your healthcare team. They can help you stay on track with your treatment plan, and they are there to help you meet your treatment goals and answer any questions you have about your medicine. The most important information about Opsumit macitentan. Do not take Opsumit if you are pregnant or trying to get pregnant. Opsumit can cause serious birth defects if taken while pregnant. Women who are able to get pregnant must have negative pregnancy tests before starting Opsumit, each month while taking Opsumit, for 1 month after stopping Opsumit. Your doctor will decide when you should take pregnancy tests. You are medically able to get pregnant if you are a woman who fits all of the following guidelines: has started puberty, even if you have not had a menstrual period yet, has a uterus, has not gone through menopause. Menopause means you have not had a menstrual period for at least 12 months for natural reasons or have had your ovaries removed. You are not medically able to get pregnant if you are a woman who fits at least one of the following guidelines: has not started puberty, does not have a uterus, has gone through menopause, you have not had a menstrual period for at least 12 months for natural reasons or have had your ovaries removed, is infertile for other medical reasons, and this infertility is permanent and cannot be reversed. While taking Opsumit, and for 1 month after stopping Opsumit, women who are able to get pregnant must use 2 acceptable forms of birth control. Women who have had a tubal sterilization, a progesterone implant, or have an IUD, intrauterine device, do not need a second form of birth control. Talk to your doctor or gynecologist about which birth control to use while on Opsumit. If you decide to change your form of birth control, talk with your doctor or gynecologist. This way, you can be sure to choose another acceptable form of birth control. Also, review the medication guide for acceptable birth control options. It's important not to have unprotected sex while taking Opsumit. Tell your doctor right away if you have unprotected sex, think your birth control has failed, miss a menstrual period, or think you may be pregnant. He or she may recommend using a form of emergency birth control. If you are the parent or caregiver of a female child who started taking Opsumit before reaching puberty, check with your child regularly for any signs of puberty. Your child may reach puberty before having her first menstrual period. Talk to your doctor if you think your child is showing signs of puberty or if you have any questions about the signs of puberty. Before starting Opsumit, women must enroll in a program called the Opsumit Risk Evaluation and Mitigation Strategy, REMS. If you are a woman who is able to get pregnant, you must talk to your doctor to learn the benefits and risks of Opsumit. You must also agree to all of the instructions in the program. Men who are prescribed Opsumit do not need to enroll in this program. Who should not take Opsumit? Do not take Opsumit if you are pregnant, plan to become pregnant, or become pregnant during treatment with Opsumit. Opsumit can cause serious birth defects. See the most important information about Opsumit. Talk to your doctor about all your medical conditions, as well as all the medicines, vitamins, and supplements you take. Opsumit and other medicines may affect each other, causing side effects. Tell your doctor right away if you take an HIV medicine. Do not start any new medicine until you check with your doctor. What should I avoid while taking Opsumit? Do not get pregnant. Opsumit can cause serious birth defects. See the most important information about Opsumit. If you miss a menstrual period or think you may be pregnant, call your doctor right away. You should not breastfeed if you take Opsumit. It is not known if Opsumit passes into your breast milk. Talk to your doctor about the best way to feed your baby. What are the possible side effects of Opsumit? Opsumit can cause serious side effects, including serious birth defects. See the most important information about Opsumit. Some medicines that are like Opsumit can cause liver problems. Your doctor should do blood tests to check your liver before you start Opsumit. Tell your doctor if you have any of these symptoms, which could be a sign of liver problems while on Opsumit. Nausea or vomiting, pain in the upper right stomach, feeling tired, loss of appetite, your skin or the whites of your eyes turn yellow, dark urine, fever, itching. Fluid retention could happen during the first weeks after starting Opsumit. Tell your doctor right away if you notice unusual weight gain or swelling in your ankles or legs. Your doctor will look for the cause. Low red blood cell levels, anemia, can happen while taking Opsumit usually during the first weeks after starting OpSummit. In some cases, a blood transfusion may be needed, but this is not common. Your doctor will do blood tests to check for anemia before you start OpSummit. You may also need to do these blood tests while taking OpSummit. Decreased sperm counts. OpSummit and other medicines like OpSummit may cause decreased sperm counts in men who take these medicines. If fathering a child is important to you, tell your doctor. The most common side effects are stuffy nose or sore throat, irritation of the airways, bronchitis, headache, flu, urinary tract infection. Talk to your doctor if you have a side effect that bothers you or does not go away. These are not all the possible side effects of OpSummit. For more information, ask your doctor or pharmacist. You may report side effects to FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. What is OpSummit macitentan? OpSummit is a prescription medicine used to treat pulmonary arterial hypertension, PAH, WHO Group 1. PAH is high blood pressure in the arteries of your lungs. OpSummit can improve your ability to exercise as measured by the 6-minute walk distance, 6 MWD. In a clinical study of mainly WHO FC2 and 3 patients, those taking OpSummit walked, on average, 22 meters farther at month 6 than patients not taking it. Improve some of your symptoms. Help slow down the progression of your disease. Lower your chance of being hospitalized for PAH. It is not known if OpSummit is safe and effective in children. Please see full prescribing information and medication guide, including an important warning about serious birth defects, on opsummit.com.